everyone. So as an esthetician, I wanted to talk about a disorder I see a lot with what I do. And I'm really seeing it primarily on people of color. So I'm speaking on polycystic ovary syndrome, better, better known as PCOS. So basically, it's a hormonal disorder in which the ovaries become enlarged and produce an abnormal amount of androgens. And what androgens are male sex hormones. So this high level of androgens, which I said before, are male sex hormones create a hormonal imbalance. And when I see hormonal imbalances in the skin, I see things like hirsutism, which is basically women growing facial hair. I see leathery like spots of your skin, which I'll include pictures because it's very distinct. Like I you either have PCOS or diabetes, or you might have both. But when I see it, I know like right then and there, like it's PCOS. And so, because of this hormonal imbalance, other things are affected, which is irregular periods. Like your period never comes on at the same time each month. It can cause fertility issues. You might have problems getting pregnant. It also can give you other health problems, which I said before, such as diabetes, heart disease, high blood pressure, what else? Cholesterol, sleep apnea, and possibility of a stroke. PCOS typically develops during adolescence, but most times it only gets tested for when a woman is well into their 20s or 30s when they're trying to conceive. So, one study found that 70% of women with PCOS go undiagnosed. So, therefore, there are a lot of females out there who don't know that they have this syndrome. And anybody who is experiencing these symptoms that I mentioned, it's good to go ahead and get tested so you know sooner than later. So, what causes PCOS? No one knows the exact cause of PCOS. However, research shows several possible contributing factors. Number one, that is always imminent for all women is genetics. If your mom had it, if your grandmother had it, it's a good chance that you're going to have it. Another factor is insulin resistance. So, insulin is a hormone that helps the body convert glucose, which is sugar, into energy. When the body doesn't respond normally to insulin, blood sugar levels increase, stimulating the ovaries and triggering androgen production. Also, obesity, because abdominal fat increases the risk of insulin resistance. Women who are overweight have a higher chance of developing PCOS. And sadly, PCOS causes weight gain, worsening symptoms, and trapping women into the cycle. Well, unfortunately, PCOS is a lifetime condition that does not disappear after menopause. However, the symptoms may diminish as you age. So, if you think it's a possibility that you may have PCOS, these are symptoms that you should look for and take serious. So, you may experience hair thinning and male pattern baldness, trouble sleeping or chronic drowsiness, headaches, heavy or irregular periods, fertility problems, and weight gain. And also, lack of ovulation can cause follicle cysts to appear on the ovaries, and these fluid filled sacs are not cancerous, yet they can be quite painful for some women. Many women with PCOS do not have cysts, which is a really good thing, which can result in delayed or improper diagnosis. Let's get into how PCOS affects the skin. So, androgens, like I mentioned before, influence hair growth, oil production, and pigmentation in the skin. So, when women's androgen levels are higher than normal, they can develop skin issues like oily, acne prone skin, hirsutism, like I mentioned before, and I don't want to butcher this term, but it's called acanthosis nigricans.
Say what?
Say what?
Say what?
Say what?
Say
What? What?
Probably butchered it. As we all know, acne is caused from bacteria, excess oil in the skin, and dead skin cells that clog the pores, creating lesions. So, because of androgens activate the sebaceous glands, women with PCOS have a higher chance of breaking out. So, PCOS-related acne appears lower on the face, like around the jawline, chin, and upper neck. So, the typical pattern for hormonal acne are those areas. These lesions may be deeper, larger, and highly resistant to treatments, often leaving acne scars. So, acne symptoms may worsen when clients are on their period thanks to an influx of progesterone, a female sex hormone that also stimulates sebum production. While clients with PCOS may not have regular periods, they can still take measures to prevent breakouts during this stage of their menstrual cycle. Rheumatism, like I mentioned before, is caused by high androgen levels and can cause women with PCOS to grow dark coarse hair in places that otherwise would not appear, such as the face, chin, neck, chest, upper arms, abdomen, or back. This hair is often much thicker than peach fuzz that would normally grow in these areas. Even when shaved or plucked, the hair readily grows back, unfortunately. This condition can be very embarrassing for women. They may feel judged or criticized by others, which leads them to anxiety, depression, and isolation. So, acanthosis nigricans, which I probably butchered, is the other condition of the skin that women with PCOS struggle with who may have insulin resistance. And when high blood sugar overstimulates cells in the epidermis, including melanocytes, it causes them to produce rapidly and release more pigment, very similar to hyperpigmentation. So as a result of this, dark patches of skin on the skin appear on the body. So in women with the Patrick types, which is basically women of color, I would say like my shade, a little bit lighter or a little bit darker than me, these patches may look leathery, but noticeably darker. When it comes to products you should be looking for when it comes to skincare, when treating these symptoms that are PCOS related, you need to look for ingredients that decrease inflammation, such as aloe vera, chamomile, and arnica. Arnica is really good. These highly soothing botanicals are incredibly healing and can basically revive your skin. Also, icing the area whichever you're experiencing these symptoms will also calm the skin as well. And two major ingredients that I always recommend for people who have skin conditions are salicylic acid and benzoyl peroxide and sulfur. They remove bacteria and get rid of dead skin cells and excess oil on the skin. So using these help keep the follicles clean and reduce the chance of breakouts. I'm gonna go more in depth. You can also do pills, alpha hydroxy acid pills, or TCA